Thanks for listening to the Wild Health Podcast. For the foreseeable future, you're not going to hear our normal intro or outro here. We're going to be releasing episodes very frequently as things are changing. This channel will be used for a very specific purpose. Number one, to communicate with our patients. We're somewhat overwhelmed, and the more we can communicate breaking news and recommendations from us to our patients all at once, the better. So if you're a patient, we're here for you if you need us, but if possible, please tune in here so we can both keep you up to date and conserve our time for the most critical tasks. Feel free to share this with friends and colleagues as well. Number two, we've organized as a group. We have infectious disease specialists, ER doctors, critical care doctors, and in total dozens of MDs, PhDs, and frontline clinicians who are going to be constantly evaluating the news and emerging evidence. We're then going to summarize and translate that for you here every day on the podcast. The speed of change with the circumstances will make us look foolish at times, but we're committed to pouring all of our resources and energy into doing what we can to help and make a difference. You can also follow our updates at wildhealth.com or our Instagram account at wildhealthmd. And if you're a patient, we're here for you. Please tune in here for the updates and let us know how we can help. Mike, we're going to ask you some specific questions. Rob, feel free to chime in if Dr. Stone is wrong. Mike, tell us real quick, first off, just the connection between sleep and immune function, and then we'll get into some specific things people can do as well.
So I'm not hearing you guys great. I'm having a little bit of connection issues. Are you hearing me okay?
Hearing you okay.
Okay, great. So, there's clearly a lot of connections between sleep and immune function. Sleep abnormalities can really suppress the immune function and lead to changes in things like pro-inflammatory cytokines like tumor necrosis factor, interleukins 1 and 6, and C-reactive protein. And I think just to get a sense of exactly how many deleterious effects can come from sleep deprivation, I've got a little bit of a figure I was going to share here. Let me see if I can get this going. But sleep deprivation drives up our catecholamines and stress hormones, disrupts our circadian rhythm, obviously, if we're not sleeping. It leads towards insulin resistance, so decreased insulin sensitivity, upregulates all the things we just talked about, TNF alpha, IL-1, IL-6, CRP, and reactive oxygen species, and leads to a decrease in melatonin production. And we'll probably get a little bit more into melatonin in a little bit. But if you look over on the right here, I mean, short-term consequences, psychosocial issues and stress, obviously we know aren't great for you, but long-term consequences, there's actually a lot of data on the long-term negative effects of sleep deprivation and poor sleep. And if we look at these cardiovascular disease, type 2 diabetes, cancer, there is a common denominator for these, which is really inflammation. And we know that inflammatory issues are really going to impact our immune function. So yes is the short answer there. There's a ton of negative factors associated with sleep dep on our immune function.
So, Mike, Rob was talking about how difficult it's been to sleep in the last few months. When the pandemic really hit, I had a difficult time for a little while because there was just so much to do. I would wake up at 4 and go to bed pretty late. And a couple of things that really helped me was phosphatidylserine, just pushing the cortisol down. Also, people earlier were asking about CBD. I was taking a fair amount of that. And then melatonin. And melatonin, we all know it's good for sleep. But when I saw that study come out, a couple studies on melatonin, it really kind of made me up my melatonin game. And I don't want to do this forever and long term. There's not a negative feedback cycle. I don't think melatonin is dangerous, but I worry a little bit about receptor density and things. So I won't do melatonin forever. But right now, talk to us about melatonin as an adjunct in COVID, either prevention or treatment, or what does the literature say about melatonin?
Yeah, so melatonin, I think first I should be really clear, and sorry for the dog barking in the background, but this is what homework does. I think I want to be really clear. There's no prospective data on, or even retrospective observational data on humans and COVID-19 and melatonin. So just to put a big grain of salt on this. We don't know prospectively about COVID-19 and melatonin, but we actually know a lot about melatonin safety. We know a fair amount about inflammatory hormone regulation with melatonin in humans, and we actually know some about disease prevention and mitigation in animal studies with melatonin. So if we kind of go in reverse order, animal studies have shown improvement in radiation-induced lung injury, improvement in reperfusion lung injury, and in viral infections in animals with melatonin treatment. And it seems like this is regulation of SIRT1 and NRF2 and NF-kappa beta pathways are really the mechanics and the major mechanisms by which melatonin has all these anti-inflammatory actions. But in an RSV model in animals, improves survival with melatonin administration. So, we're not mice, and extrapolating that to humans obviously has its limitations. But in terms of human data, there's nothing in COVID-19, as I mentioned, but in diabetic patients, 6 milligrams a day for 8 weeks in a prospective RCT reduced TNF alpha, IL-6, and CRP. And there's an interesting meta-analysis of 22 randomized controlled trials showing reduction in TNF alpha and IL-6 in humans taking melatonin regularly. So it does seem like there's a really strong anti-inflammatory signal with melatonin, and not something I was previously aware of until I started looking into it, seeing some of the data trickling out theoretically around COVID-19. And I can tell you have a question, Matt, but I have one more thing, which is safety. And melatonin is like the ketamine of sleep medications. Ketamine has a wide safety margin. You can give 10 times the dose and people will just be asleep for a really long time or sedated for a really long time, but without any real danger to them. And melatonin in intensive care unit patients, which is probably where this is most relevant right now, has been administered 10 milligrams daily for a month with no adverse outcomes, and that was a placebo-controlled trial. So just demonstrating safety, and obviously intensive care patients are, challenged for sleep in general with the sleep-wake disruption that comes with people checking on them and the beeping and noises and everything else. And we know that sleep depth's a big issue for ICU patients. And one study, safety of melatonin up to 1 gram daily for a month. So, that's what makes me kind of compare it to ketamine, because, we typically will recommend 0.5 milligrams, maybe up to 1 milligram, maybe up to 3 milligrams of melatonin nightly for sleep in a general, healthy person. But if you're talking about 1 gram, that's, 2,000 times what we're recommending as a dose. And people tolerate that safely. It doesn't seem like there's going to be much of an added benefit at those kinds of doses, but certainly you don't have to be worried. I would echo your sentiment, Matt, that at least in the short term, a month's worth of melatonin at 6 milligrams a day or 10 milligrams a day, I don't see anything in the literature to suggest that that's dangerous at all.
A couple really good questions from the audience. One was about absorption. I don't remember this specifically yesterday, but someone said that it wasn't absorbed orally, and they suggested sublingual. I've always thought that sublingual was a little quicker because it got into the bloodstream more quickly, but oral you still absorb. Is that your understanding, or do you have a different?
These safety studies, many of them were done with oral. Many of the animal studies were done with oral. I think if you have a sublingual product and you prefer that, I can't see a reason why that would be anything to shy away from, but I haven't seen anything terribly convincing that there's no efficacy from oral melatonin.
The other question I thought was really good from an audience member says, are those reductions in inflammatory response due to the melatonin or because they're sleeping better? Was that teased out in these studies?
Not to the extent that I would have liked to see it, but I did not see any of these studies do like real-time EEG monitoring to look at sleep-wake cycles and sleep architecture. So certainly it's possible, but I think these are, given the regulation of SIRT1 and NF-kappa beta and the cytokine issues that we're seeing and the proposed mechanisms, again, there's good physiological reasons why this would work independently as an anti-inflammatory besides just making you sleep more.
Speaking of melatonin, Mike, why doesn't it work better for sleep?
You mean, why don't you sleep well with melatonin?
I just feel like everyone I talk to who takes melatonin for sleep has very little benefit from it from a sleep architecture standpoint. And do you get that sense as well?
I do. I mean, I think that, as with most of the things that we do when we take an approach at Wild Health and in our general practices, we know that adding a medication, whether it's prescription, over the counter, herbal, peptide, is usually a small component of your overall strategy for success. And I think some of the behavioral factors and environmental factors that we can adjust around our sleep are going to be far more impactful for sleep in general than just taking a melatonin. It's, if we're going to take Rob's evening routine and kind of flip it on its head. If you come home from a busy day at work, drink a big cup of coffee, turn the lights on, read on a screen for a couple of hours in bed, and turn the heat up in your room, you could probably take a gram of melatonin, and I doubt you're going to be sleeping. So there's a lot of other issues involved besides just taking a medication to help you sleep.
What would be some of those recommendations, Mike, in terms of, I don't know, a few tips that you could give people to improve their sleep?
So I can give you my favorites, and then I'd love to hear if you guys have additional ones that I'm leaving out or things that you think would add. Lights out early. So, and when I say lights out, if you can get natural light, whether it's candlelight or just dimmed lights in the home for the 2 to 3 hours before you sleep. Avoid blue light for at least 2 to 3 hours before bed. And while blue blocking glasses are great, I think just avoiding blue light in general is even better. If you've had your genomics run and you know what your caffeine metabolism is like, I'm drinking coffee right now. I can drink coffee up until 1 or 2 in the afternoon. I don't have any real effects on my sleep. But there's a lot of people out there who are slow caffeine metabolizers, and they should really be limiting their coffee or eliminating it. And if they do have it, very early in the morning. Keep it dark. So blackout shades, if you have them, or just a nice dark room, turning off LEDs in the room. Turning off any notifications on phones or tablets or things that could beep and keep you up. You definitely want to try and keep it cool, so sort of low 60s Fahrenheit. You could consider using a cooling blanket or a chili pad type product if that's helpful for you. I do think tracking your sleep is a phenomenal approach, and whether you're using a Whoop band or an Oura ring or some other product, Matt loves to say what gets measured gets managed, and I think that's true. I think if you're seeing that you're getting poor REM sleep, you can try some interventions to target that. If you're seeing that your deep sleep is being interrupted, you can try some targeted interventions there. And if you're seeing that your timing around your sleep or your latency is bad, there's other things you can look at. So that just, knowing what your sleep architecture looks like helps you take a targeted approach towards improving it. In terms of medication, avoid prescription sleep medication. Sorry, Rob, but trazodone, Ambien, not only do they disrupt your normal sleep architecture and get you more light sleep as opposed to that restorative REM and deep sleep, but increased all-cause mortality in people who are using prescription sleep medications over time. So we definitely want to avoid those at all costs. And in terms of things you can take that don't seem to have that and seem to be beneficial, well, we've already kind of talked about melatonin, but typically 0.5 to 1 milligrams is what I'll recommend for patients. Maybe higher during COVID, and I'd be interested in sort of the group thoughts of are we going to start taking 6 milligrams at night during this pandemic? CBD, many people find very useful for sleep. There are some genomic SNPs that will make that more or less likely for an individual patient, but 50 to 100 milligrams an hour or two before sleep. L-tryptophan, 1 to 3 grams. A lot of people have good success with, especially with nighttime awakenings. And then some really gentle stuff like chamomile, lavender, and then phosphatidylserine, like Matt was talking about, at a 250 milligram to 1 gram dose. Those are all additional medications or supplements you can use for sleep. So those would be my big tips for optimizing sleep in 2 minutes or less.
One of our audience members just published or typed in a link to an article from PubMed from the Journal of Clinical Pharmacology in 2000, the absolute bioavailability of oral melatonin, which found that a 4 milligram dose, there was a 15% bioavailability due to first pass metabolism in the liver, which is interesting. I would suggest a benefit for sublingual.
Yeah, so bioavailable, but not as bioavailable as sublingual. And that if you're taking let's think about it for a second. If we know you can take a gram by mouth for a month and have no side effects, if it's easier for you to get an oral formulation and you're taking 6 grams, you're basically getting about a gram bioavailable. So I think sorry, if you're taking 6 milligrams, you're basically getting about a milligram bioavailable.
Curious as to what you guys think on this. Like the staying asleep part, I've found that the thing that has helped the most beyond all of it, not drinking water several hours before going to sleep has been helpful, but taping my mouth shut. And I don't know if this has been discussed on the show yet. We've got these, I don't know if you can see them in here. They're like snore-less strips so that you're just breathing through your nose throughout sleep. My wife and I started doing this, I think over the summer, and I haven't used an Oura Ring for this to see like a case control, but the quality of sleep feels much better. The depth of sleep and also like the length of sleep and awakenings, just profoundly different. And also the feeling of being rested the next morning. I didn't think I was breathing through my mouth, but clearly I am. And as far as side effects, have found it has very few, except maybe a little bit of lip stickiness from the strips.
Yeah, I've used actually just paper tape, just the medical tape like you'd find in an emergency room for us or anywhere else. And I was surprised at how comfortable and how much it improved my sleep. I didn't think I would be able to tolerate it across my mouth, but I found it to be very useful as well.
Well, on the advice of friends and family, I often tape my mouth shut, but that's usually during waking hours.
Day. Yeah. We have a lot of questions here. If you're tuning in and expecting Ben Greenfield during this time, when he shows up, we'll put him on. I've texted him, and we may have some. Ben, if you can hear me and you're not a panelist, text me back or let me know. We may have to promote you to panelist or something like that. But we've got a lot of sleep questions, so we're going to start rolling with them. People are talking about your daytime routine to help with night too, not just at night. And I think that's really important. I think a really good night's sleep starts in the morning when you wake up. Like Dr. Zubkov was talking about yesterday, getting early morning sunshine to make sure that circadian rhythm is really set. Getting outside, not just being inside all day. Historically, we've had different time fluctuations and changes throughout the day to warmer and cooler, and that temperature is a signal to our body too to get up and to be awake or to go to bed as well. So throughout the day, getting some exercise, I found for me is really important to be able to sleep well that night. And then that routine in general. Someone just commented that they actually, and this is a great idea, they've done the mouth taping and then watched their Oura Ring. So this is, if you are tracking your sleep, it's a beautiful way to do these N of 1 experiments where you think, would this work for me? And then you try it, and you can actually get some objective data over the course of a week comparing to your baseline. So that's a great idea. Someone asked about the receptor issues with melatonin and shutting down the pineal gland's natural production and feedback loops. I have some thoughts on it, but Dr. Stone, what do you think about that from your research?
I think not a terrible concern in the short term. It's hard to, I haven't come across anything that gives me like a magic dose or duration of therapy where I would worry about suppression. But I think that suppression has been, the initial concerns about it were probably over exaggerated. I know you've looked deeply into this, Matt. I don't know if you have any data to support that, but
I actually had an argument about this over. I guess it wasn't really an argument; it was a text argument. It was a really nasty text argument. But the reason was because I just sort of assumed, and I had heard this in multiple places, that if you take melatonin, it decreases your endogenous production of melatonin. And I think I took that offhand without any research, which is unfortunate. But the reason being that the majority of our endocrine system has negative feedback loops. And I sort of, this is developed by the pineal gland. It sort of basically functions as a hormone. So naturally it has a feedback loop, right? Maybe, but then you think about it, and if you think about it, what produces melatonin is the absence of sunlight. So you don't need a negative feedback loop. The sun is your negative feedback loop. And once I thought about it like that, finally it started to make sense. And then plus Matt sent me like 5 articles that said that it didn't do that. So that helped.
So Ben's texting me that he's been here. So Jody, I think maybe you need to promote him to a panelist because he's not showing up on the list. So what we're going to do with Ben, actually, we should all take best before he comes on, whether he's going to be in a cold plunge or outside, and whether there'll be a shirt on or not before he comes on. He says he's here. He's typing into the panelist view.
You know, Matt, while we're getting Ben online, the one other thing that I just wanted to mention, we were originally going to cover fasting as well during COVID-19. And just real quickly, I would recommend against prolonged fasting right now, just because of the effects on cortisol. And we can certainly maybe at the end of the day, if people have questions around time restricted feeding or fasting, we can get into it. I think not enough time right now. But if I had to have one take home right now is probably not the time to be doing a 3-day water, coffee only fast. And we can dive back into that later on in the day if we have time.
Thanks so much for listening to this COVID-19 update. Please send us your questions or follow along on Instagram and Facebook at Wild Health MD. And just to be clear, this is not medical advice. No patient-physician relationship has been established, and this resource is really for general informational purposes only. And finally, if you want to spread the word, please send this podcast to friends and family and give us a review on iTunes. Thanks again, and stay safe.